Hello, good day, everyone. This is your nurse Edwin again. Let me share with you my experiences. This is quite funny experiences back in the day during my first 3 to 6 months here in the United States. Before we migrated here to the US, I remember we had this acculturation class that my agency offered for all those who are about to be migrated to the United States. So during this acculturation class, it has been discussed about, the usual culture, the nursing atmosphere that you're gonna be encountering, even on how to communicate with the patient, how to address the doctor, those basic stuff that you're gonna be encountering once you step in as a nurse in the United States. So, but this is quite funny experience. I had one of my patients during my first 3 months was asking for Dr. Pepper. I do not know about Dr. Pepper, guys. I have no idea what Dr. Pepper is. So all I know is, in my mind, the patient was asking for Dr. Pepper, a doctor, a physician. I didn't know that it is something else. So only to find out that Dr. Pepper in the United States is soda or soft drinks. Then what I did, because as I said, I don't have any idea about what Dr. Pepper is all about. So I went to the nursing station and asked for Marcy. I asked Marcy. Marcy was the charge nurse. I said, "Hey, Marcy, my patient in 429 is asking for Dr. Pepper." And then she looked at me as if like, "Are you kidding me, Edwin?" Something like that. I was like, "Yeah, the patient is asking for Dr. Pepper." And then this is what she said. Marcy said, "Edwin, go to the fridge." I said, "What is fridge?" Because I do not know also what fridge is all about. Fridge, they refers the fridge as refrigerator, and Dr. Pepper as soda. I said, "No, no, no, Mercy." I said, "The patient is asking for Dr. Pepper." I was really insisting that the patient was asking for a doctor. So what Mercy did, she went to the patient's room. I go along with her, and then she asked the patient, "Hey, Mr. So and so, what do you really need for Edwin?" And this patient answered, and he said, "Oh, I was asking for Dr. Pepper." "Oh, sir, what do you want?" This is Marcy said. "What do you want? Is it the regular or the diet?" So I was like, what is she talking about? So immediately, when we stepped out of the patient's room, we proceeded directly to the kitchen. And then Marcy said, "Hey, Edwin, this is the fridge." She opened the fridge, and then she said, "These are the Dr. Pepper. The patient can ask for either a diet or the regular Dr. Pepper. This is soda." Okay, just to continue about there's another experience I had on answering phone calls. Again, it's phone calls. All right, so this is what happened. During my first 3 to 6 months in the United States, I usually make it a point that I am in an area wherein it's away from the nursing station. The main reason is that because I was scared of answering phone calls. And I was scared for simple reason is that I could hardly understand on their accent. I'm not familiar with the medications, with the procedures, with the lab works, just stuff like that. So the only strategy in order for me to not to answer the phone is stay away from the nursing station. But there's one time wherein I was getting orders from the doctor, and then I was writing down what to do, stuff like that. I was in the nursing station basically. So during that time, the phone is ringing, and our secretary, who his name is Ben, was already on the phone, and Marcy, my charge nurse, was also on the phone. So There's no any other person around except me who gonna answer that phone. So Marcy was like, because it keeps on ringing, it when she shouted and blurted out and say, "Hey, Edwin, please answer the phone." So I don't have any choice but to grab the phone and answer it. So this is what I say. "Hey doctor, this is Nurse Edwin. How may I help you?" And this is what he said. "Hey, I'll just gonna put a telephone order for my patient in room blah 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 blah." I said, "Sir, I'll get your nurse because I'm not the assigned nurse for your patient." "Oh, no, 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 Edwin. You are a nurse. Can you just write down my order and put that in the computer? These are my orders for this patient." I said, "Oh, okay. Just wait. I'll just gonna grab pen and paper." So immediately he said, "Okay, I'll write down your orders." So there are some other orders that I can easily understand, but most of those orders is I was like, "Doctor, I can't understand what you're talking about." And then I keep on saying, "Pardon, pardon," because I need to make sure that his message get across to my understanding. If the message is relayed right, in other words. So, but I keep on saying pardon, and he was annoyed. He got irritated already. And then until such time he said, "Would you please pass the phone to the charge nurse? I'm dead tired of that you keep on saying pardon." I was really embarrassed. I said, "Oh, I'm sorry, doc." So immediately I hand over the phone to my charge nurse, Marcy. And then Marcy got all the orders again from the doctor. So, and then the next day, because I was working night shift that time. So the doctor came in to make his rounds, and he was looking for me. "Who is Mr. Pardon?" This is what he was not looking, "Who is Edwin?" But instead he was like saying, "Who is Mr. Pardon here?" So I was really embarrassed. Everybody was just laughing. I was so I feel so bad for myself that time. They call me Mr. Pardon. And then in fact, this is the most insulted comment I got from my colleagues. And she is a certified nursing assistant, and she said, "Are you really a nursing professor back then in the Philippines?" Because they know that I was a nursing professor back in the Philippines. I was teaching in. "Why can't you not understand English?" I said, "I can understand English. It's just that I could not understand their accent." It's not that, I was trying to kind of defend myself, justify it, the reason why I could not answer or I could not understand fully of what they're trying to tell me. Because again, as I said, just give me at least another 6 months to really understand about the usual accent of the Native Americans here. I was so embarrassed. There's another funny experience I had during shift report. It happened during shift report. I was the oncoming nurse, and I was still waiting for one more patient to give from the nurse to give report. So that particular time, I was assigned for 4 patients. So I already received reports from my 3 patients. So there's one more left. And the nurse assigned on day shift, I could not find it. I've been looking around the whole unit, the whole nursing unit, but I could not find this particular nurse. So when I look at the board, apparently the name of the nurse was Patience. She was from Nigeria. So I still look for her because it's almost close to 8 o'clock and I still have medication due at 8 p.m. So Ben, our secretary, suggested, "Why can't you use the intercom?" I said, "When I use the intercom, it will be heard all throughout the patient's room and even in the hallway." I said, "No, let me try to find out because she might not be happy about it." So, but Again, I was already desperate. It's almost 5 minutes to 8 p.m. I still have due medication at 8 p.m. So I heed to his suggestion. I use the intercom. And this is what happened. In about seconds, like 15 seconds, 20 seconds, patients from our floor were all running towards the nursing station and trying to find out what's going on. They were all panicked. And I was so embarrassed. And I said, I am sorry. I was looking for the nurse patients, not you guys. So I was so embarrassed because of what I did. And then finally, nurse patient showed up. And guess what? She could not even crack to smile. Me and Ben at the same time could not stop from laughing out loud because of what happened. So just imagine, during the entire time when patients was giving report to me, she was so unhappy. I can really sense of her frustration of what I did. That's another thing. And another one, another hospital experience. I was on my way to work. That was probably on my 2 weeks in the US. So it's still on my orientation. And I was about to go to my unit, and apparently I have this African American guy who was who joined me in the elevator. So when we were in the elevator, this African American guy asked me, "How are you today?" I said, "Huh? Do you know me?" It's not a typical in the Philippines. Someone is asking you, "How are you today?" So I was like, as if you do it if you know that person, right? So when he asked me how I am doing, I was really surprised. I said, "Do you know me?" And then he was just laughing. He was like, "Oh, no, I was just trying to be nice, asking you how's your day going." So, I'm so sorry, sir. I said, so I think he was able to find out that I am very new and naive, I would say, in the American way. So he asked me, "Where are you from?" And guess what? This is what I say. "Sir, I'm from Oras, Eastern Samar." And who the hell know about that place? I should have just said, "I'm from the Philippines." But hindi na sinabi ko. I said, "I'm from Oras, Eastern Samar." That was total embarrassment. I said, "I am really sorry, sir." Again, those are my experiences as a new nurse in America.